How did XDR-TB become a global health threat? Imagine a tiny bacteria causing a disease that once was easy to treat, becoming resistant to almost every medicine we have. That's what happened with extensively drug-resistant tuberculosis, or XDR-TB. This bacteria, called Mycobacterium tuberculosis, evolved over decades, making it harder and harder to kill. The story starts with how tuberculosis was traditionally treated with a few key drugs. When treatment plans were incomplete or not followed properly, some bacteria survived. These survivors developed mutations that made them resistant to drugs like isoniazid and rifampicin, leading to multi-drug-resistant tuberculosis. Over time, some strains gained resistance to even more powerful drugs, including fluoroquinolones and second-line injectable medicines. This created XDR-TB, which is resistant to at least 4 of the main drugs used to fight TB. A major turning point was in 2005, at a hospital in KwaZulu-Natal, South Africa. There, an outbreak of XDR-TB spread rapidly among patients, especially those co-infected with HIV. Many of these patients died quickly, showing how deadly and contagious XDR-TB could be. This outbreak made the world realize that XDR-TB wasn't just a local problem but a global threat. Genetic studies reveal that some XDR-TB strains have been around since the 1960s or earlier. These strains originated in regions with social upheaval and weak health systems, such as parts of Central Asia and South Africa. Poor healthcare infrastructure, social instability, and economic challenges allowed these resistant bacteria to spread across borders. Migration and movement of people further helped their global reach. Several factors fueled the rise of XDR-TB. Inadequate treatment programs often failed to ensure patients completed their therapy, giving bacteria the chance to develop resistance. Limited access to fast and accurate testing delayed proper treatment, allowing resistant strains to spread unnoticed. High rates of HIV infection also played a role, as immunocompromised people are more vulnerable to TB and its resistant forms. Hospitals sometimes became hotspots for transmission due to poor infection control practices. Additionally, social and economic disruptions, like poverty and conflict, weakened healthcare systems and hampered disease control efforts. Today, treating XDR-TB remains a challenge. It takes longer, often more than a year, with more drugs that can cause severe side effects and cost thousands of dollars. The limited options for effective medicines mean that preventing its spread is crucial. The World Health Organization stresses the importance of better diagnostics, access to new drugs, stronger health systems, and public health strategies to stop XDR-TB from spreading further. In essence, XDR-TB became a global health threat because the bacteria gradually developed resistance through improper treatment and social factors that allowed it to spread widely. It's a reminder of how important proper health care, early detection, and global cooperation are in fighting infectious diseases. Always remember, if you suspect TB or have concerns, consult healthcare professionals for personalized advice and treatment options.